Hello everyone. Today we are going to talk about the P spikes approach. So the P spikes approach is basically defined for the doctors when they are going to break the bad news. So P here stands for the preparation. That means that a doctor, suppose we are going to declare a cancer patient about what their condition is, we need to be prepared about the diagnosis. So we should know the what is the diagnosis, and we should know what it is prognosis, and we should be aware that how we are going to declare that bad news. So all these conditions should be known prior to us. Then only we can actually go to the patient or the relatives to declare that what their condition is that and what the prognosis, and can answer to all the questions they are asking. Next, S is stands for setting up the interview. Setting up of interview. So setting up of interview means nothing but before, whenever we are going to declare the diagnosis or prognosis to any patient, we should set up a quiet environment, like we set up a quiet room. We should know that the patient wants whether their attenders should be there or not. So we should arrange for that. We should keep all the phones in silent. And also we should be mentally prepared to deal with the emotions coming out from the patients. So this is what is called as the setting up of interview, which is very important before going to declare that. Next, before declaring, we should try to find out what the patient or their attenders already know about the condition. Like you ask the patient, suppose your patient is suspected to have some mass and you have done the evaluation. Now the patient has come. We will ask that what do you know already about the condition you have? So the patient can say that he had got a mass which has sent for a biopsy. Now he's waiting for the reports. So first try to know that what the patient knows, because that becomes very important. So because then only we can take it step by step and we can declare him what the diagnosis he has. So perception is also very important. Next, I is invitation. Invitation means that ask the patient whether he wants to know everything about the disease, or he wants to only know it very superficially, or he doesn't want to know about the prognosis and all. So invite the patient to know how much knowledge he wants to know about that. It is called as invitation. K stands for the knowledge and information. So knowledge and information means here we actually deliver the knowledge or the disease condition and its prognosis to the patient. And this has to be told in very normal languages, that is to layman language. That means that you should not use a medical terminologies too much. You should make it as simpler as possible, and that is called as knowledge and information, and go step by step. Next is empathy and emotion. So obviously when you declare something a very bad, that is a bad news is declared, a lot of empathy will be there and emotions will be there. So you should try to empathize the patient, that let they give them some time to react to that, to absorb the truth. You should give the patients or their attender some time. Also you should give them sympathy, that I know it is tough, but we are here to help you as much as possible. Try to speak some soft words to them that will give some empathy to them. And last S is strategy and summary. So that means that once the patient is emotionally ready, after the news they have received, the attendant has received the news, you should be able to tell them what are the best care which we can give to them. So what are the strategy to deal that, or strategy for management of that, or what is the palliative care which we can give to them. So you should be able to tell them at this time, which is called as strategy and summary. So on summary, P spike stands for P is the preparation. That means the doctor should be prepared about the condition. S is setting up a quiet environment, or called as setting up of interview. P is for perception, what the patient is already known about its condition. I is invitation, invite the patient that how much he wants to know about the disease. K is the knowledge, to tell the patient everything about the disease and the prognosis. E is empathy and emotions. Give patients some time, show some empathy, and deal with the emotions. And finally, tell them about the strategy, how to manage them, and how to deal with the condition at present. Thank you.